My dad, Dr. Michael Lebowitz, and myself, Dr. Noah Lebowitz, have a small research-based practice on Maui. My dad has been practicing applied kinesiology for over 40 years, and myself 10 years now in clinic. And we treat patients with all of the weirdest, strangest, and most chronic issues going on. And we have patients flying in from all over the United States as well as from other countries. That can be patients with Lyme disease, chronic fatigue, autoimmune issues, and a lot of different things that people have seen 30, 40 doctors for and aren't getting good results. And they come to us and we spend a lot of time with them. We try to evaluate them from many different aspects using applied kinesiology and our technique, which my dad has been teaching for over 30 years now. And thankfully, we're able to get good results with a lot of people that had given up hope before.
I discovered AK probably in 1976. I was interested in natural health and I happened to take a Touch for Health class. And it just seemed so magical in certain ways, how you could get muscles to respond differently when touching different points, testing different muscles, exposing people to different substances. When I started chiropractic school, I read every ICAK USA collected papers that existed at that time, started studying with Dr. Goodhart and Schmidt, and it's all progressed from there. I think the fascinating thing about AK is it really tells you what the body needs. You can do all the lab tests in the world, but it won't give you a why. It'll give you a quantity, but it won't tell you if it's an issue for the person. If the person's high in a particular mineral, like a toxic mineral, can they tolerate it or not? Some people have a small amount and they're very sensitive. Some people have large amounts and they're okay. So AK, more than any other system, really zeroes in on what the patient needs to improve their health. Our topic today is a combination of different things we do in the office to evaluate circulatory and heart issues, checking for different coagulation factors, checking for any damage to the heart due to various things, checking for things that might imply that there's plaque buildup or vasoconstriction. So just an AK approach that covers a lot of bases that some people who have basically negative results on labs and on EKGs and so forth, that we can pick up things before it becomes critical.
When first learning AK, the most important thing you need to learn is to accurately muscle test. And once you're very confident in your muscle testing, the next thing is taking out any preconceived notions and being open but also very skeptical of anything that you learn. No matter who teaches you a technique, you need to see, is it reproducible when tested blindly? That's something Dr. Goodhart, Dr. Schmidt always taught. You need to see if things are reproducible between practitioners with accurate muscle testing. So again, AK can be the most wonderful, fascinating, and scientific diagnostic tool that you can use in the world, and you will get results that no other doctor in the world can get. But you need to look at it from a very scientific and reproducible way, and if you do this, you will do amazing things.